After the fall of Roe, Chicago quickly became one of the most important access hubs in the country. Patients now travel here from across the Midwest and the South. For some, the trip is hundreds of miles. For others, it's more than 1,000 miles. But distance alone does not explain what it takes to make care possible. Behind every appointment is a network of people coordinating travel, funding, housing, and support. But at this point, you already know this, right? Abortion funds are the connective tissue of access. They help patients pay for procedures, but their work goes far beyond funding care. They help coordinate travel, cover lodging and transportation, provide meals, supplies, and sometimes the small things people didn't realize they would need. Because when someone travels across the country for health care, they are leaving their entire support system behind. Abortion funds step in to help rebuild that support, even if only for a few days. This is comprehensive funding infrastructure. This is a coordinated system built to ensure that access is real and there for anyone who may need it.
So, my name is Alicia Hurtado. I use they, them, or she, her pronouns. I'm the Director of Advocacy and Communications at the Chicago Abortion Fund. A little bit about the Chicago Abortion Fund is Illinois' statewide abortion fund. We are the largest independent abortion fund in the country, and we provide things that an abortion fund provides. We help folks with financial support, logistical support, emotional support. We can get into what that means a little bit later as well. But yeah, I think really our big mandate is to make sure that the protections that folks have worked so hard to build here in Illinois, and I like to remind folks that Illinois was not so different from other Midwest states just 10 years ago. So really thinking about that arc of all the different policies that have been chipping away slowly at the restrictions that did exist in Illinois. Just making sure that foundation is not just accessible to Illinois residents and not just accessible to the people who can afford to come here. And so through that, we have a really robust helpline program for direct service. We've got my work. We have our communications and advocacy work, and yeah, I think all of that really works together around that central mission.
Yeah, absolutely.
I joined the Chicago Abortion Fund in 2020, and I think just speaking to our more recent history as well, the shift pre and post Dobbs has been so drastic in that, you know, really everything in our landscape changed. People were traveling such further distances, and I do think something that we knew going into kind of our preparation for the Dobbs decision or preparation for Roe falling was that we had a blueprint for access across state lines already. We had folks from Indiana, for example, that were coming to Illinois, and so we were already supporting folks across the Midwest coming to Illinois for care. And I think that work built on, I just talked about House Bill 40. I'll probably talk about it a lot, but that was another inflection point in our work. Before the implementation of House Bill 40, we were not able to support everyone who called us. We were only able to support Illinois residents, and we did have to turn people away.
Right.
And in that was kind of the shift that allowed us, because Medicaid was covering abortion care, to then turn outwards and think, okay, well, we know that not just Illinois residents are accessing care. I said earlier, House Bill 40 was 2018, 2019, a huge wave of abortion restrictions flooded across the Midwest, and we saw so many people coming to Illinois, and because we had those resources here, we were able to leverage then, okay, well, we can support the person from Indiana crossing state lines to get here to Illinois. And I think that shift then turned into, when we're prepping for the fall of Roe, okay, so for getting someone from here to here driving, what is that going to look like from Texas, from Alabama, from Florida even? And I think that programmatic scale, I would love to talk more about that, because it really, there's no blueprint for abortion funds. We're all really figuring this out as we go. And I think the only thing we can do is really keep our core mission in mind, which is, making sure that people can access abortion care no matter who they are, no matter the resources they have, no matter their zip code. And I think that is something really special about our network and about so many of the funds that we're so lucky to work with on a daily basis. And this work is hard. There's no roadmap. And so we talk about that all the time, where it's like, in some ways it's the challenge, but in some ways it's also, it gives us so much room for creativity to meet people where they are, to remain nimble and flexible. And so I know you asked about history.
That was
going through a bunch of different things, but I think the 40-year legacy is like a piece of the puzzle. It's so incredible to think about how abortion funds have been doing the work, and even pre-abortion funds, people were doing the work to allow people to access care underground. And we've seen in the last 10 years in Illinois so many shifts that have allowed us to continue to iterate on the work and expand, and that has been a whole new project, I think, especially I think for all of us in the last couple of years.
Not every patient arrives at the same point in pregnancy. Some people discover their pregnancies later. Others spend weeks navigating bans, raising funds, or securing travel. By the time they reach care, they may need later stage services. Providers like Hope Clinic for Women are critical parts of the Access Network. They offer care that many clinics across the country no longer provide, and they do so in a landscape where those services are increasingly rare. Without providers willing to offer this care, many patients would have nowhere to go.
Hi everybody, I'm Louisa. I use she, her pronouns, and I'm the Chief Operating Officer of Hope Clinic Chicago, which is the second location of Hope Clinic. We are an Illinois-based abortion provider with clinics downstate in Granite City, which is right across the river from St. Louis, and here in Chicago, which just opened last June. And Hope Clinic Granite City has actually been around since 1974. They are celebrating what will be their 52nd year this year as a provider of high-quality, compassionate abortion care. And despite all of the challenges of this world and the political landscape right now, we're really, really thrilled to be able to open a second location, which is our Chicago-based location, which is where we are right now. And we were opened with the express purpose of focusing on providing abortion care later in pregnancy.
So can you tell me a little bit more about what does later abortion care look like?
Yes, absolutely. So our Granite City location provides abortion care in the first and second trimester, and they are amazing at doing that. But our ownership really identified a need for a later abortion care access in the Midwest. And so Hope Clinic Chicago was opened with the focus of providing abortion care later in pregnancy. Prior to our opening, if someone was more than 28 weeks pregnant, they would have had to travel to Boulder, Colorado, or Washington, D.C., Maryland area to get the abortion care that they needed. And for obvious reasons, needing to travel thousands of miles is a huge barrier to people, and often means people don't get that medical care. So Hope Clinic Chicago was opened with that in mind, and in the first 8 months of operating, we have seen about 250 patients from 22 different states. There are a lot of reasons why people need abortion care later in pregnancy. One that's most commonly identified is when someone who has a wanted pregnancy gets some sort of medical diagnosis, whether that's for the pregnant person or the fetus, that leads to the decision to terminate that pregnancy. That is certainly a set of people who we see and are really honored to support in their journey, and a journey that often means making complicated and sometimes very sad decisions. But there are also people who need later abortion care because they have been pushed later in pregnancy by the barriers that they're facing to accessing care. Maybe they knew they needed an abortion much earlier in their pregnancy, but it took months to coordinate the childcare, the gas money, the funding, the time off work to actually access an appointment, particularly if they were forced to travel across state lines. There are also people who just don't know they're pregnant until later in their pregnancy, and people for whom social circumstances and more general circumstances have changed such that it's not it's their choice to not want to continue a pregnancy. And we're really honored to be able to support that full range of individuals in accessing the abortion care they need and making sure that people who don't want to stay pregnant don't have to. When patients come here to the Chicago location, at the gestations that we're supporting, appointments are 2 or 3 days long. You don't stay overnight here at the clinic, but you do need to stay within 30 minutes of the clinic. And so what that looks like for out-of-state folks is that one element of practical support we might help coordinate with our abortion fund partners would be a hotel or other lodging so that you have somewhere near to the clinic to stay on those 2 nights in between the 3 days of your appointment. On the first day, the process looks like doing paperwork, having a medical intake conversation with our staff, getting an ultrasound, and then going through the first initial sort of medical steps of your process. And then over the subsequent 2 days, there are other medical steps that are supported by doctors and nurses and patient care assistants to prepare your body for the procedure so that it's as safe and comfortable as possible. We offer a variety of resources throughout that time to support folks with sort of their social and emotional well-being in addition to their physical well-being. There are amazing support resources like the All Options Talk Line, like the Chicago Abortion Fund's post-abortion counseling circles, which are held over Zoom. We have pamphlets of resources, spanning a range from, religious resources if you would like sort of religious comfort related to the abortion decision you're making, family support resources, practical support like how to enroll in SNAP or WIC or things like that. Because we know people are coming from really complex lives. Many abortion seekers are already parents, and they know what a responsibility it is to be a parent and to take care of children. So we do offer, we have handouts and coloring books for kids if they come with family members to an appointment. We have a baby changing table in our bathroom so that you can take care of your child if they come with you. We do allow one support person to join you for your appointment, so you can have a trusted friend or family member with you. We do limit that at 1 just for space reasons. And we offer various options at the end of the process to memorialize your pregnancy. So if this is part of a bigger grief or loss experience, we're here to talk about that and provide referrals and resources as well as ways we can honor the pregnancy with you while you're here. And what we are here to support is bodily autonomy and choice. Our sort of tagline is where there's choice, there's hope.
But healthcare doesn't stop with the procedure. Patients arriving in Chicago often come from much warmer parts of the country. They may not have packed for cold weather. They may not have planned for overnight recovery. They may not have had time to think about anything except reaching the clinic. That's why some abortion funds and clinics offer things like food pantries, community closets, worn coats and gloves, basic supplies for recovery. These resources might seem small, but they reflect something much larger, a model of care that recognizes patients as whole human beings. The road to care is long, but the road home carries something different: relief, reflection, and the quiet strength of people who have navigated barriers most of the country will never see. In the final episode of The Road to Care, we follow that journey home, and we honor the courage of the people who traveled this road and the communities who made sure they didn't have to travel it alone.